A regular Thursday medical segment brought to us by Kaiser Permanente, and joining us today is Dr. Richard Roth. He's the Chief of Service, Department of Allergy with Kaiser Permanente here in Orange County. Dr. Roth, welcome to the program.
Thank you very much.
Good to have you with us. A little bit about your background, your training, and how you ended up here in Orange County with Kaiser.
Well, my background, I grew up in Minnesota, and I went to college in Minnesota. I went to the medical school at the St. Louis University. And from there, I did my pediatric training and then decided I want to be an immunologist, in part because I grew up with allergies. And it was kind of a natural for me, and I could relate to a lot of people who had similar problems. So came out to California, did my allergy training, initially with Harbor UCLA, and then finished up my training as the first fellow at Kaiser Permanente in Los Angeles. And then it was a very easy transition to go right into Kaiser Permanente in the first available facility, which turned out to be Bellflower. Spent a few years there, then went to Orange County, where I've been for the past 30-some years. And so now I've been a long time practicing allergist.
You definitely have indeed. Well, let's talk about that. From a medical standpoint, how do you folks define this? Actually, what is an allergy?
Well, an allergy is really an abnormal immune response to things that are floating around or things that are ingested or things that people can come into contact with that most people don't have an adverse reaction to. So it's an immune response of a different type. It's not an immune response like one might see from a bacterial infection or a vaccination or those kinds of things, but natural substances that normally don't affect normal people, but people that have a predisposition to allergy, they are going to be affected in one way or another.
Right. I guess everybody from time to time either has a rash or an itch or a runny nose or a sore throat or something, and they're not sure what it is. They go to the doctor. How do we know it's an allergy? How do we know it isn't just something more or less normal that we all get?
Right. And it is important to make that distinction because a lot of people are walking around with the notion that they have allergies and have had them for a number of years, but they really have not had allergies. They may have had allergies and something else. And the something else that we often see in allergy when we evaluate patients are sensitivities to things. Common sensitivity would be something like a reaction to a strong odor, a fragrance, smoke, fumes, irritants of any kind. Allergies are more to things like pets, pollens, molds, dust mite, foods for many people. But again, it's not all that common. It's not as common as most people would like to believe. With food allergy, it's certainly under 10% of the population that has true food allergy, probably closer to 5%. And with inhalant allergies, it's more in the range of 15 to 25%. So again, the majority of patients don't have allergies. Many people, if not the majority, feel that they've got an allergy to something.
And they really don't.
And they don't.
Right. Well, we've seen, for example, the new first family getting a dog. One of the requirements there was, I guess the kids have some pet hair allergies, and so they had to get a certain kind of dog. I know poodles supposedly, and I guess the dog they ended up with don't contribute to allergies of that kind of allergy. We hear of kids allergic to peanut butter, of all things, and if you read labels, amazingly number of products that have peanuts or peanut butter in them. So there's a lot of those kinds of things which I guess affect young children. But adults can have allergies as well. How do you actually test for that? How do you know if somebody truly has an allergy?
Well, there are different ways to do it. The traditional way is with allergy skin testing, which requires a specialist. So a patient has to come into the allergy clinic, has to be referred in most cases, unless it's a self-referral system, which in some cases it may be a self-referral. But the patient comes to the allergy clinic, they either get skin tested or they get the evaluation and the physician decides not to do skin testing but to do a lab test or a blood test, which has become more and more popular over the years, in part because it's become more refined over the years and now is really almost at the same level of accuracy as the skin tests are. So in many cases, if a patient comes in to see me expecting skin tests, I may order the blood test instead and spend more time with the patient discussing their problem and trying to come to some resolution.
Right. So really, the family doctor would probably be the first step in most cases and then referred to you, although you said some people show up on your doorstep by themselves.
Right.
Right.
Yeah.
All right. Treatment, and is there a cure?
All right. Treatment, the three basic ways of treating allergy. Number one is if you identify what the allergen is, you try to avoid it as best as you can. Now, that's not always a practical thing to do, especially if it's a pollen floating around in the air and it could be there for several weeks to months, or dust mite, which isn't all that easy to avoid, although there are some measures that one could take to avoid house dust mite, and we lay those out for the patients. Usually some pretty simple measures, but there is some cost involved. With patients who have multiple sensitivities where it's very difficult to avoid all those things, what's recommended is generally some medication, and now we've got good medicines that used to be prescription, now they're over the counter, easy to obtain, relatively inexpensive, in fact, in many cases, very inexpensive, and effective for most patients. Maybe 2/3 to 3/4 of the patients who take the over-the-counter medicines and they truly have allergy should get relief to a significant degree. If that doesn't work, then prescription medicines, and one of the prescription medicines very popular now for allergic rhinitis or nasal allergy symptoms are the steroid nasal sprays. Something that is really safe to use in the vast majority of patients. They're not going to get into trouble with it, and very effective, more effective than the over-the-counter antihistamines.
I guess that's true with any medication. You won't get in trouble if you're doing the correct dosage and you listen to the doctor and the pharmacist and take it when you're supposed to.
Correct, and that's right. You take it appropriately.
Right. A lot of times we hear, especially with children, they have an allergy to this, but they may outgrow it.
Correct.
That sometimes happens, correct?
Correct. And where it's more likely to happen is if you have an infant that's allergic to, let's say, cow's milk protein or soy protein, generally they're going to outgrow that allergy. If they develop sensitivity to a nut, peanut, tree nut, shrimp, shellfish, any of those things, generally that becomes more of a lifelong situation, although it's interesting. In pediatrics, if a child develops peanut allergy early on, the likelihood of that child outgrowing peanut allergy just over time is about 20%. You take an adult who develops peanut allergy, which certainly can happen also, the likelihood of the adult outgrowing that allergy or getting over it over time is about 5%. So there's a difference there in the ability to get over it.
Right. So I guess the important thing is to, one, know if we do have true allergies, know what they are, and be aware. Not in the first cure there is to not do what sets you off, and then as help with the allergist, deal with the medications that might be helpful as well. Very helpful information, Doctor. Thank you very much. You know, a lot of times people get the sniffles and assume they have an allergy, and that may not be the case. So again, follow up with your doctors for more information on that. Well, that's our medical segment each week, and again, that comes to us from Kaiser Permanente. Of course, you can give them a call if you want more information, find out more about the good services they provide right here in Orange County. Give them a call, 932-2052, for additional information on Kaiser Permanente. We'll be coming right back with more right after this.